We start with the growing row over the shortage of tests for coronavirus, especially in some of the UK's worst affected areas. Senior figures in the NHS are warning that operations are being cancelled because of these testing shortages. Matt Hancock, the Health Secretary for England, admits the system is facing an enormous challenge, which could take weeks to sort out. He says tests will have to be prioritised, with people in healthcare and in care homes being put first. Our health correspondent Dominic Hughes reports on the situation in Greater Manchester.
Stories from a testing system that seems far from world-beating.
If you don't spend all day on the site, I don't think you would get a test. Whenever I see the tests appear, there's only about 20. I'm pretty sure there's more than 20 people in the Bristol area.
At times, frustrating and bewildering.
I'm a Year 4 teacher. He was sent home last Wednesday due to COVID symptoms of persistent cough. There were no tests available Wednesday. He kept trying to book during the day, and he was given the same places some of my parents have been suggested to go to, like Aberdeen and Llandudno.
And the anxiety of a worried parent.
He's had a high temperature. He's supposed to be in school. What do you want me to do? Just leave him out of school for indefinite? I've been trying since the last 2 days. So I've got a message here that says the system is currently available. That's been the last 2 days.
HIV vaccinations that have already come in.
And even healthcare workers are experiencing similar problems. Sheffield GP Dr Krishna Kasaraneni, now back at work, waited 9 days for his family's test results.
My practice manager was on the phone too to try and find out the results. It has been a very, very challenging time, and we've not even hit the peak of winter months yet. And it really does worry us to say, if we're not prepared now, what's going to happen in the next 2-3 months when the flu season hits and there's going to be quite a lot of chest conditions and infections. And that does worry me as a GP.
And delays in testing are not helping a health service already under intense pressure.
We're absolutely at full pelt in the NHS at the moment, trying to recover the services where treatment was understandably, but unfortunately delayed because of COVID a few months ago. We're trying to get through those cases as quickly as possible, and we simply can't spare members of staff waiting for tests.
Ministers say they are putting extra resources into testing centres in COVID hotspots like here in Trafford in Greater Manchester. And that might well account for some of the difficulties people are experiencing in booking a test. But from right across the country, stories are emerging of people who are waiting days before finding an available slot or being sent to testing centres that are hundreds of miles away.
Should the Secretary of State Johnson Ashworth?
Labour says the unanswered questions over the government's handling of testing are piling up.
When will ill people no longer have to travel hundreds of miles for a test that should be available on their doorstep? When will pupils and teachers out of school get access to testing so they can get back to school?
Well, I think that we will be able to solve this problem in a matter of weeks. We are managing to deliver record capacity, but as he well knows, demand is also high, and the response to that is to make sure we have prioritisation so the people who most need it can get the tests that they need.
And tonight, a plea from the local hospital in Bolton.
Please do not attend the hospital here if you think you've got COVID-19 for testing.
In this town, with the highest infection rate in the country, the Accident and Emergency Department is being overwhelmed by people seeking swab tests. This is a system that looks like it's struggling. Dominic Hughes, BBC News.
Well, back in the month of May, Boris Johnson was promising what he called a world-beating test and trace system. As we've been reporting, an increase in demand for tests has led to lots of local shortages, with some people, as we heard in the report, being advised to visit test sites hundreds of miles from where they live. Our health editor Hugh Pym has been looking at what's been going wrong in the search for a more reliable system.
Some testing centres like this one were ticking over as normal today. The government says there are more tests being done in the UK than in most European countries. So why is it sometimes so difficult to book a test? There seem to be enough testing sites, but there are bottlenecks in the laboratories for processing the swabs taken. That's why they're limiting the amount of slots for the public, just when more people want to get tested. Testing capacity, that's how much the labs can handle, was rising until June, but then it flattened out a bit before increasing a bit recently. It now stands at more than 243,000 tests a day. the number of tests actually processed reflecting demand has been increasing steadily, and the gap's fast closing. It now stands at around 206,000 a day. You always need a bit of spare capacity, but that's fast being eaten up. Demand for testing has risen partly because children are back at school and there's a strong focus on safety and reducing risk.
So if you have an individual kit...
Scotland's clinical director says with lockdown easing and society opening up, a greater need for testing was inevitable.
So as you open, more people are out and about, so you would expect more symptoms. But you have to let schools back. So we've prioritised schools at the expense of some other elements of society. So I'm not surprised we're seeing increased testing demand. We've just got to try and balance the supply and that demand.
So where is the UK laboratory testing capacity? First of all, there are NHS and public health labs analysing tests for staff and patients, about 72,400 processed in one recent day. Then there are new government-run lighthouse labs and privately run centres handling tests for social care staff and residents and the public, about 133,300 in a day. The big lighthouse labs carry out work for all the UK nations. There have been reports they're overstretched with staff shortages. There have been calls for explanations.
We have to recognise there's been a massive expansion in capacity in recent weeks, but nonetheless there is a crisis at the moment in many schools and hospitals who can't function in the way they need to without these test results. So it is vital that the Health Secretary does solve this problem.
Ministers say the NHS and social care will be prioritised for tests, with the problems across the system unlikely to be fully resolved for a few weeks. Hugh Pym, BBC News.
All this comes as the UK has recorded its lowest weekly death toll since March, with fewer than 100 COVID-19 deaths in the past 7 days. The latest official daily figures show that there were 3,105 new cases of coronavirus recorded in the latest 24-hour period. That means the average number of new cases reported daily in the past week is 3,096. 27 deaths were reported of people who died within 28 days of a positive COVID test, and that means on average in the past week, 11 deaths were recorded every day. And that takes the official number of deaths so far in this pandemic across the UK to 41,664. So with that in mind, let's talk once again tonight to our health editor, Hugh Pym. Hugh, we mentioned there the problems with testing, and then the Minister introduced this notion of prioritising. What more can you say about that?
Well, Hugh, back in July, there was a healthy surplus of capacity, the ability to process tests over the amount which were actually required. And system leaders were putting out the message, certainly in England, if people felt unwell, it was best just to go and get a test. Then you've had this dramatic increase in demand. Should that have been predicted? Well, that's another question, with schools going back and so on, and only a finite amount of laboratories going up rather slowly, that capacity, and there isn't a big one coming on stream now till October. So Matt Hancock told the Commons that it would be a few weeks like this current situation. So there would be prioritisation with NHS staff and patients and social care staff and residents put at the top of the queue, if you like, and the rest of the testing capacity would have to be shared out by others who might actually need it. Now, will that be sustainable? Well, that is the big question. Just at this moment, you need a working testing system with case numbers rising. You need something that's actually going to have public confidence to spot the local outbreaks which may be developing.
Hugh, many thanks again. Hugh Pym there, our health editor.